The United Nations has suspended aid deliveries to hundreds of thousands of people in Sudan. The World Food Programme says the escalating civil war has forced it to stop working in parts of Jazeera province. Sudan's army has withdrawn as its paramilitary rivals, the Rapid Support Forces, advance on Wad Medani. Up to 300,000 people have since fled from a city that was a safe haven for many displaced people. And for more, I'm joined now from Nairobi by Clementine Nkweta-Salami. She's the United Nations Humanitarian Coordinator in Sudan. Clementine, it's good to have you with us. Talk to me about what is the situation right now in Wad Medani?
The situation in Wad Medani is very desperate. I would say we are extremely concerned. Of course, the recent fighting has led to the displacement of about 250 to 300,000. We're concerned by the vulnerable people that remain there. So the fact that we've had to suspend our activities in terms of our presence, our physical presence there. We still try to, of course, monitor the situation at a distance, but that is in no way ideal. Of course, our concerns about the ability for the population there to access health services for those that are injured and wounded. We have some concerns about the hospital infrastructure, but we've tried to make sure that through our engagement with the RSF, that there is a clear message passed to them that they have a responsibility. Ours is not a request. It's really to underline that they have a responsibility to make sure that civilian infrastructure is not invaded, that people have access to medicine, that people also have the right to leave if they so choose as well.
And how would you assess the overall humanitarian situation in Sudan at the moment?
It is dire. It is dire. We're 8 months into the conflict, and quite frankly, we don't see the fighting abating. We've had mass departures from the country. 1.3 million have left the country as refugees, but we also have a significant IDP population, and we're looking about 7 million people that are displaced internally. We struggle to access these populations. We face a number of bureaucratic and access impediments. Insecurity, of course, is key, but also some of the bureaucratic measures that we need to comply with that would allow us to move freely throughout the country and to protect as well as assist the people. We have a cholera outbreak. We have about 7,700 cases of cholera. We've already registered 216 deaths. And with this new outflow from Madani towards the east, we fear, of course, that the cholera numbers will continue to rise.
I've got about 1 minute left. I want to ask you, the situation in Sudan is often referred to as the forgotten war. Much of the world's attention has been focused on Israel, Hamas, Russia, Ukraine. Is that affecting efforts to drum up international aid for Sudan?
I think it is. I think we are nowhere near the overall appeal that we made for 2.6 billion. We've only reached 1 billion to date. We're grateful, of course, to our donors, but the Sudanese people, I think their needs are as important as other displaced populations. And that there should be greater efforts to mobilize resources. But of course, what the people want is a ceasefire. They want an end to the conflict, an end to a situation in which many have lost their family members. They find themselves in desperate situations. We're struggling to keep the pipelines open. So these are the messages that I think need to be heard. But more importantly, we need the support at this time in an urgent manner.
So many people in Sudan, so many people around the entire globe just wishing for peace at the end of this troubled year. Humanitarian Aid Coordinator for Sudan, Clementine Nkweta-Salami, we appreciate your time tonight. Thank you.
Thank you.